Hello, Pradeep sir. Welcome. Good afternoon.
എന്താ അത് ദൈവത്തിനറിയാം. ചിലപ്പോൾ ലോക സ്ഥിരീകരിച്ചിട്ടായിരുന്നു ആരോഗ്യ പ്രവർത്തകരല്ല ന്യൂസ് കൊടുക്കുന്നത്. എന്താണെന്ന് പറയാൻ
Dr. Shabir, you there?
കുട്ടിയുടെ നമ്പറില്ലാത്തതുകൊണ്ട് ഒരുപാട് ബുദ്ധിമുട്ടിയായി. എന്റെ നമ്പറാ എന്തെങ്കിലും ആവശ്യമുണ്ടെങ്കിൽ എന്നെ വിളിക്കണം.
ஸ்டார்ட் பண்ண போர் அடிக்குதுங்களே 10 நிமிஷமா.
ഒരു പ്രശ്നം ഉണ്ടായി, ഞാൻ ഔട്ടായി പോയി. ഇപ്പൊ വെയിറ്റ് ചെയ്യാം. മാഡം ആണോ ഇപ്പൊ പോസ്റ്റുള്ളത് എന്നെ ഒന്ന് അൺമിറ്റ് ചെയ്യാവോ? മാഡം ആണോ ഇപ്പൊ പോസ്റ്റുള്ളത് എന്നെ ഒന്ന് അൺമിറ്റ് ചെയ്യാവോ? മാഡം എന്നെ ഞാൻ ഔട്ടായി പോയി. ആരാണ് പോസ്റ്റ് അറിയില്ല. അത് പ്ലീസ് വെയിറ്റ് ചെയ്യും. മാഡം ഓർത്തെങ്കിൽ ഒന്ന് അഡ്മിറ്റ് ചെയ്യാമോ? ആ മാഡം എനിക്ക് കേറാൻ വേണ്ടി പറ്റും.
Hello, good afternoon. Sorry for the disturbance. Hello. Okay, shall we start, Father? Hello, Dr. Sheela, madam, can you hear me?
Yeah, I can hear you.
Okay, Father Jery, can you hear me, Father?
I think Father is unmuted.
Okay.
Yeah.
Okay, shall we start? Sorry, Father. Sorry, the participants.
Okay.
Network problem. We are starting now. So, very good afternoon. All greeting from Lisie College of Allied Health Sciences. Today, the second day of EXCELLENTIA, the academic webinar series. First of all, let me thank all authorities, faculty, students, staffs, and participants who made this program successful. Before starting the session, I thank and welcome Reverend Father Paul Karaden, Director Lisie Hospital, Father Shinu Munjali, Lisie Assistant Director Lisie Hospital, for the wholehearted support to conduct this seminar. Thank you and welcome you all, Reverend Fathers. And today's session will be inaugurated by our dearest and respected Reverend Father Jery Njaliath, Assistant Director Lisie Medical and Education Institution. His vision and gifted leadership has always inspired us. Father, welcome you.
Thank you. Hope you all can hear me.
Yes, yeah. Father, before that, today we have the speaker, Dr. Sheela Sasikumar, head R&D at Hycare Hospital, Chennai, and she's a well-known personality in academics and research, especially in diabetes and herbal formulation. Personally, she was my mentor and research committee member during PhD program. Dr. Sheela, madam, we welcome you all. And once again, I welcome you all. And now I request Reverend Father Jery Njaliath to inaugurate this second day of EXCELLENTIA webinar series. Father, please.
Thank you, Dr. Shabir. Most respected Dr. Sheela Sasikumar, all academicians from various colleges who are present here in Zoom and also watching live on Facebook, students from various colleges, my dear friends, a warm good afternoon to you all from Lisie institutions. I just make a short introduction about Lisie institutions. Lisie Medical and Education Institutions is a trust, is a charitable trust under which we have different colleges, namely Lisie College of Allied Health Sciences, Lisie College of Nursing, and Lisie College of Pharmacy, where in all these three colleges we have got almost somewhere around 600 students studying in different streams, and around 50 teaching faculty helping these students in their career, in their education, and in informing values in their lives to make them professionals who have got values with them. That is one of the core vision of our institutions. It is not just to produce professionals, but professionals with correct values in them, so that they can do whatever they do with these with a character. That is what we aim for, and that is where all these people and all our well-wishers are helping to achieve vision of ours. And Lisie College of Allied Health Sciences I would say, in the present form, it is the baby in that sense, because the College of Pharmacy started years back. The College of Allied Health Sciences in this form has started just a few years back. But I'm really happy, I'm really glad that this small baby of ours is making huge steps forward in establishing its name in the area of allied health sciences in Kerala and in India, and I would even say abroad. And the role, the leadership Dr. Shabir is taking in this aspect is commendable. I really appreciate him for that. And I am really happy that in this time of distress, this COVID-19 times, where people sometimes go to may not be able to apply their creativity in whatever they do. Lisie College of Allied Health Sciences, under the leadership of Dr. Shabir, as they thought about it, and they planned a webinar series, and they have implemented it very well. We already have had our first webinar already, and that was a huge success. I participated in it for some time, and then I also got some feedbacks, and that all give the impression that that was a huge success. And we are into the second webinar of this webinar series, and we have got a very eminent personality, Dr. Sheela Sasikumar, an administrator, researcher, and educator. A person, I don't think we cannot have a better person than Dr. Sheela Sasikumar to address us, to lead this webinar in this distress times, in these difficult times in the lives of all of us and many people all around the world. And it is a very important theme as well, adjuvant therapy for boosting immune system during this COVID times. I think this is a very relevant theme that is chosen for this webinar, and I am really happy for that as well. So I don't take much time, because the core moment of this session is the session by Dr. Sheela Sasikumar. So we don't want to take much time away from that. With the permission of all the people who are in the Zoom platform and all the people who are watching live in Facebook, I declare this session as inaugurated, and I wish you all a very fruitful time in this webinar. Thank you. All the best. Have a great time, and I hope that all the people who are participating are keeping fine wherever they are in the world, and their families and their communities, I hope, are staying fine, healthy, and once again, I wish all the best. Thank you. Dr. Shabir. Dr. Shabir there?
Okay, Father, can I start?
Yeah, sure. Please go ahead.
Okay, then. Thank you.
Father.
Yeah.
Can I introduce about Dr. C. Sheela Sasikumar?
Okay, please. That was a very. I just told her to go ahead because I didn't hear any sound. I actually was thinking that there would be a person to introduce. Please go ahead.
Okay, Father. I thought Sir will be there. That's why I didn't respond that time.
Okay. Kindly, please go ahead.
Okay. Good afternoon and a very warm welcome to everybody once again. I am Purnima, Assistant Professor, Lisie College of Allied Health Sciences. It's my privilege to introduce our chief guest of today's webinar series. Whenever we choose our chief guest, we try to take people who can be icons, mentors, and role models for our students. And we are very proud and happy today that Dr. Sheela Sasikumar has agreed to present a class for all of us on the topic Adjuvent Therapy, Minerals and Vitamins as Immune Boosters for COVID-19. Dr. Sheela Sasikumar. She is from Chennai, Tamil Nadu, having a brilliant academic record. She has completed her post-graduation and Master of Philosophy in Clinical Biochemistry from University of Madras. She is a strong research professional with a Doctor of Philosophy focused in Clinical Biochemistry from University of Madras. She has been published more than 40 research papers in national and international journals and 4 chapters in environmental biotechnology and toxicology based books. And her research interests are pathology of type 2 diabetes, wound healing, and bio-nanoparticles, mitochondrial alterations in myocardial infarctions, therapeutic role of phytochemicals, and bioremediation. Starting her career as an HOD of DG Vaishnav, she has risen to the position of Coordinator of Biotechnology Department in Loyola College, Chennai. In her journey, she has held many responsible positions as Chief Scientific Officer, Senior Research Consultant with a demonstrated history of working in the hospital and healthcare industry. She is an accomplished educator at the college level and educational environments for more than 20 years. Most significantly and presently, with her experience, she leads as an HOD of Clinical Research and Development in Hycare Super Speciality Hospital, Arumbakam, Chennai. Respected ma'am, thank you so much for being with us today. On behalf of Lisie family, I welcome you to the online audience. Dr. C. Sheela Sasikumar, HOD of Clinical Research and Development in Hycare Super Speciality Hospital, Arumbakam, Chennai. Welcome, ma'am.
Thank you, Purnima. Good afternoon, all. At the onset, I wish to thank the management of Lisie College of Allied Health Sciences for providing me an opportunity to share my views on COVID-19. COVID-19 is a major global public health concern and a leading cause of hospitalization. So I'll share my views on this regarding the adjuvant therapy, minerals and vitamins as immune boosters for COVID-19. Am I audible?
Yes, ma'am.
Okay. So my topic is concerned with adjuvant therapy. Let us see each one of them in detail. You can reach me in the following IDs. So if you want to see, I have published more than 55 research papers, and you can view my papers in all these IDs in the research IDs. Thank you. Now, coming to COVID-19 pandemic situation. COVID-19 is a very difficult situation to handle, but a different situation, we can handle it in a different way. But we need to learn new things, practice new things, and implement in your life. COVID-19 is rapidly affecting our day-to-day life in all aspects, especially health, social, economy, all the ways. It has destabilized the global economy, and world trade is expected to fall between 13% and 32% in 2020. Social distancing, self-isolation, and travel restrictions caused a decrease in the workforce and loss of jobs. The unavoidable declines in trade and output will have a painful consequences for households and business on the top of human suffering caused by the disease itself, loss of life, and irrevocable damage to the society. Okay, we saw in all ways what happens in the healthcare sector. What is the impact in the healthcare sector? COVID-19 pandemic will have a long-term impact on healthcare. Because of this infection, because of the easy contagious infection, we need to approach different strategies. It can be novel approaches for elective surgeries, Digital health options will rise. Expect innovations with drones and robotics to handle in future. So I have given you a hyperlink where you can go across to see the changes in the healthcare sector due to COVID-19 pandemic. Coming to the virus, the best defense against any outbreak is a strong system. If you have a strong health system, if your immunity is strong, you can withstand the infection, you can fight against the infection and protect yourself. Now, here I have shown you a picture of the virus. The virus name is coronavirus. COVID-19 is nothing but coronavirus disease 2019. The unique pathogenesis of this virus is in both upper and lower respiratory tract infection and gastroenteritis. Now, here if you see, it is more, the picture shows that this is more concerned with the respiratory tract infection, and the droplets that comes out can carry the virus. Now, regarding the virus is a RNA virus enveloped single-stranded RNA positive sense with a spike on the surface. For this virus to enter and cause the infection, the life cycle should happen. There are 5 steps in the life cycle. 1, attachment. 2, penetration. 3, biosynthesis. 4, maturation. 5, release. Once the viral genome enters, what happens? We'll see that. Before that, the viral genome encodes 4 proteins. Now, if you see in the picture, you can see the 4 proteins. One is spike protein or S protein. Another one is M protein or membrane protein, envelope protein or E protein, nucleocapsid protein or N protein, out of which the spike protein is the one which facilitates the entry of the virus into the host cell. Now, if you see the transmission before seeing the pathogenesis, how it is transmitted. Transmission may occur in 2 main routes, possibly. Droplets produced from an infected person who cough or sneeze contain the virus, and this becomes the means of transmission. So the 2 routes can be spread to people who are nearby within 2 meters, such that the droplets could be inhaled into the lungs, or by touching a surface or an object or a hand of any infected person. So that is why we are requested not to hug or shake hands, so that to protect us from the direct entry. So regular hand hygiene and cleaning of frequently touched surfaces will help us to reduce the risk of infection. So this is how the virus gets transmitted from person to person. Now, coming to the pathogenesis of this virus, if you see, the pathogenesis I have shown here as a picture. You can see the picture. Now, the viral genome for encoding the 4 proteins we have seen. These proteins play an essential role. When the COVID virus comes in contact, you can see the picture here, it binds to the receptor. So this is going to be the target cell. Now, the COVID virus will bind to the target cell through the receptor. So this becomes the first step of the life cycle, that is attachment. The second step is penetration. Penetration is nothing but entering of the virus into the host cells through the endocytosis process or membrane fusion process. So that is the second step. Third step is about the binding of the spike protein with the receptor. The spike protein has 2 receptors, has 2 portions, S1 and S2. S1 is concerned with the 2 domains are here, S1 and S2. S1 is concerned with binding of the host cell with the receptor. S2 is concerned with fusion of virus with the cell membrane. Now, when it attaches, the virus with the spike protein attaches with the receptor. What is the receptor here? The receptor is going to be angiotensin converting enzyme receptor. This receptor is critical for the virus entry. Once virus forms a complex and it facilitates the way inside the host cytoplasm. So you can see it enters into the host cytoplasm. Once the viral genome enters into the cytoplasm of the host cell, it changes or brings an alteration. What happens? First, it translates two proteins called PP1A. This is called polyproteins. So these two proteins are named as PP1A and PP1B and also produces structural proteins. Now, once it enters, it brings the synthesis of these proteins. It starts to replicate. The new enveloped glycoprotein, so you can see how the replication happens, translation happens here. The new enveloped glycoprotein inserted into the membrane of the endoplasmic reticulum. So you can see the rough endoplasmic reticulum here, followed by Golgi apparatus. These are the two subcellular organelles that play a role. So the new enveloped glycoprotein inserted on the membrane of the endoplasmic reticulum or Golgi apparatus. The nucleocapsid formed by the combination of, this is the nucleocapsid formed by the combination of genomic RNA and the nucleocapsid proteins. Now the viral particle starts to germinate into the complex called ERGIC. This is nothing but endoplasmic reticulum intermediate compartment. So this vesicle now contains the viral particles. These viral particles, which is placed inside the vesicles, are sent out by fusing with the plasma membrane, and this releases viruses. So the all step of the entry, that is attachment, penetration, all happens and finally releases the virus from the cell. So large number of viral particles will be released. This is how it creates the pathogenesis inside the cell. This is one part of the mechanism. Once this happens, if a healthy individual, in case of an healthy individual, he starts to produce the antibodies, fight against this pathogen by increasing the WBC count, by producing certain markers and all those things. If a person has a lesser immunity, what happens is that he weakened immunity, he cannot fight. So in case of severe cases, it releases some factors called cytokines and chemokines. These cytokines and chemokines produces uncontrolled systemic inflammatory response. The pro-inflammatory cytokines that is produced causes hyperinflammation, and there will be a change in the body where there will be increase in the erythrocyte sedimentation rate, increase in the protein called C-reactive protein, increase in procalcitonin, which is a marker for sepsis. All these causes hyperinflammation and leads to a specific syndrome called cytokine storm syndrome. This cytokine storm syndrome is responsible for the SARS, that is severe acute respiratory syndrome, which leads to the death of the individual. This is how the virus enters and produces the pathogenesis in the host cell. The host is going to be the human being. Now, what are the signs and the symptoms of COVID-19? So we all come across the social media and we have variety of input regarding the symptoms. So we have a collective data of all these symptoms: dry cough, sore throat, difficulty in breathing, tiredness, fever, respiratory failure, septic shock. Severe symptoms can be seen in the individuals with a weakened immune system, aged groups, and people who suffer from comorbidities like diabetes, cancer, kidney disease, chronic lung disease, etc. Now, the incubation period is estimated to be 14 days for this virus. Usually, to confirm, we collect a sample. The sample should be sent to only the BSL3, Biosafety Laboratory, for doing the testing. So BSL Laboratory are the authorized persons who can work on the pathogenic organisms. So based on the symptoms, based on the severity, the sample can be collected from the upper respiratory tract. The upper respiratory tract can be nasopharyngeal specimen, oropharyngeal specimen, nasal mid-turbinate swab, anterior nares, nasopharyngeal wash. So I have given you a collection. The swab is introduced and the sample is collected from the individuals who are suspected to have this. Now, if the symptoms are going to be a little bit severe, what are the other specimens we can opt for? You can go for collecting the bronchoalveolar lavage, tracheal aspirate, pleural fluid, lung biopsy, sputum in case of severe cough cases. So that the sample has to be collected by well-trained health professionals. The sample which is collected can be stored between 2 to 8 degrees C for up to 72 hours after collection, and then the test can be performed. Normally, when there is any infection other than COVID, whenever a human being is coming across an infection, what happens is that we raise the WBC count to fight against the pathogen. So we show some changes in our blood picture. So there will be, as I said, change in the increase in the erythrocyte sedimentation rate, increase in the WBC count, which we do normally by doing a test called CBC, complete blood count. Apart from this, certain proteins called acute phase reactants are released in to show that there is an infection. So these proteins can be used as some markers to identify the infection. They are nothing but C-reactive protein, but C-reactive protein is a common protein produced for all infection, and procalcitonin. Procalcitonin is a marker for sepsis. Then we can do specific tests. Normally we do antibody test, antigen test, and antibody test and antigen test we can do it, and antigen test we can do it when there is a circulation of the antigen in the body. Antibody test can be done to understand whether the person has come across the virus. Confirmation for this COVID-19 can be done by a method called real-time polymerase chain reaction, where we are going to use the nucleic acid sequencing method. So this will be the standard method for the confirmation. New tests are being discovered, and it will be released into the market as soon as the standard protocol is being adopted and the regulatory guidelines are followed. Now, till now, we should understand there is no vaccine for COVID-19, but vaccine trials are in progress globally, including our Indian government. So, having known about the transmission, the pathogenesis, the diagnosis, etc., we should understand evidence of human-human transmission is confirmed in case of close contact. So in the absence of specific treatment, there is an urgent need to find an alternative solution to prevent the control of replication and pathogenesis. We need to seek ways either to potentially protect from the viral infection or to alleviate its effect once trapped. So we need to search for the potential protective and therapeutic antiviral strategies that is of particular urgent interest. So what comes in the picture? Your immune system is your vaccine today. If your immune system is strong, you can conquer. So the questions that come in our mind, the very important and significant question that rises in our mind is, can you boost your immune system to fight COVID? Yes. How? By taking a healthy diet. So we are going to see how diet also plays a role. So is nutrition concerned with immunity? Immunity or immune system is a system, it's a cells which is made up of different components, which we'll see later. So it is a system. You know what is a system? Cells together form tissues, tissues together form organs, and organs collectively form a system. So who guidance on the diet, especially during the current pandemic, states that good nutrition is crucial for health, particularly in times when the immune system might need to fight back. Nutritional status is a modifiable factor and a key element in functioning and maintaining of our immune system integrity. Immune system depends on adequate amount of nutrients that is available, carbohydrates, fats, proteins, vitamins, and minerals. Here I'm going to talk about the role of micronutrients, that is vitamins and minerals. It is well stated that deficiency or insufficiency in nutrients caused by inadequate intake, reduced absorption, bioavailability, requires correction to properly maintain the immunity. The European Journal of Clinical Nutrition concluded that without adequate nutrition, the immune system is clearly deprived of components needed to generate an effective immune response. So now we'll come to our topic, that is adjuvant therapy, a combination therapy where minerals and vitamins can be used as a supportive therapy. There are a lot of minerals, both trace minerals and the minerals that is needed for the larger amount. So among the micronutrients, we are going to see the role of zinc in this infection. Micronutrient hemostasis is a key factor in a healthy immune system. Trace element like zinc is a very important factor. It's a cofactor for many proteins involved in cellular process like differentiation and proliferation. On an average, an adult weighing 70 kg has a body zinc content of 1.4 to 2.3 gram, the highest tissue concentration being in the prostate gland, seminal fluid, uveal tissue that is present in the cornea and the skin. The recommended dietary allowance of zinc for an average adult male is 11 milligram, and the requirement increases from 8 milligram per day up to 12 milligram per day in females, especially it increases during pregnancy and lactation. Having understood the recommended dietary allowance, what causes the deficiency or depletion of zinc? Zinc deficiency can be caused by inadequate intake, poor gastrointestinal absorption, or augmented excretion. That imbalance of zinc cause diseases and promote disease progression. There is a paper that is published in 2016 regarding the vitamins and minerals, and they have quoted as zinc is undernutrition in India. So the concentration of zinc, that is micronutrient, is found to be very less in the Indians. The role of zinc in COVID. What is the mechanism that makes zinc to be an important factor or a vital component to fight the disease? So zinc is called as an antiviral, or it is a factor that can modulate the antiviral and antibacterial immunity and regulate inflammatory responses. Zinc deficiency is surprisingly common in modern lifestyle and resulting in dysfunction of both humoral and CMI, that is cell-mediated immunity, increasing the susceptibility of that individual to infectious diseases. Improved antiviral immunity by zinc may also occur. So whenever there is a decrease, whenever it is supplemented and the balance is maintained, this zinc may cause the upregulation of factor called a protein interferon alpha. Interferon is a protein produced by the host to fight against the viral infection. In vitro experiments have demonstrated that zinc cation, zinc 2+, possesses antiviral activity through the inhibition of the enzyme SARS-CoV RNA-dependent RNA polymerases. So since they are all RNA virus, they use RNA-dependent RNA polymerases for the mechanism. Indirect evidences also indicates that zinc may decrease the activity of ACE2, known to be the receptor for the SARS-CoV-2. So it prevents, or it is reported that it can cause the decrease in the activity of binding. So the picture we saw that the penetration process can happen only if the virus through the spike protein binds with the ACE2 receptor. Improved zinc test is also required to reduce the risk of bacterial infection by improving the mucociliary clearance and barrier function of the respiratory epithelium, as well as direct antibacterial effect against pneumonia. Several studies have reported that zinc is a broad spectrum antiviral activity for a variety of viruses. There are papers and research articles stating that both in vitro experiments, that is in cell culture experiments, as well as in case of trials, they have proved the role of zinc as an antiviral activity. Zinc status is also tightly associated with risk factors of severe COVID-19. So when a person, as you age, this is a normal phenomenon. As the person ages, the zinc concentration also decreases. So thus they become a risk factor. A weakened immune system and comorbidities like obesity, diabetes, atherosclerosis are the groups which are supposed to be a risk group for zinc deficiency, can be the risk group of COVID-19 infection. Increased intracellular concentration of zinc. So whenever we try to supplement and maintain the intracellular concentration, it can bring its direct action on RNA-dependent RNA polymerases enzyme and also certain proteins that are essential for the completion of different phases of life cycle. I told you there are 5 steps for the entry of the life cycle. So in this 5 phases or 5 different steps, it may require various proteins. Increasing the concentration of zinc. So zinc has to enter into the cytoplasm across the membrane through ionophores. These ionophores are called as zinc ionophores. So there are various papers stating that zinc along with the zinc ionophores like pyrithion can efficiently impair the replication of RNA virus once the infection starts in the body. So collectively to say that zinc possesses protective effect and it can be used as an adjuvant therapy for COVID-19, and it can show as an adjuvant, it can show or it can prevent. How? By reducing the inflammation. We know hyperinflammation is going to be a very important thing for SARS. It can reduce the inflammation, improve the mucociliary clearance, prevention of ventilator-induced lung injury, modulation of antiviral and antibacterial immunity. But still, there are a lot of trials going on globally, but still we need to show many experimental studies for this. So zinc supplementation has also been documented to decrease the oxidative stress created by ROS, reactive oxygen species. Results in decreased generation of cytokines. So during the pathogenesis, I told you there are a lot of pro-inflammatory cytokines, interleukins, tumor necrosis factor alpha. All these cytokines will be produced in large amounts. Results in decreased generation of inflammatory cytokines by upregulating a factor called A20. This factor A20 is a protein called zinc transcription factor, which inhibits the activation of the NF-kappa B. Consumption of up to 50 milligram of zinc per day may provide a protective role against this COVID-19 pandemic, likely by improving. So how it does? By improving the host resistance against the viral infection. So ultimately, the individual assessment for the possible dietary, nutritional, lifestyle, and environmental risk together with the proper risk management is the sensible way to deal with this pandemic. I'm audible, I'm thinking, right?
Yes, madam. Yes, madam.
Yeah.
Suppose you can increase the volume.
No, I can hear some sounds in between, so I do not know.
Okay.
People talking.
Yeah. They are not muted, I think. I'll ask them.
There are conversations going on.
Yes, ma'am. Yes, ma'am. I asked them to mute their speaker.
Okay, thank you. The next important, under micronutrients, I told you about the mineral that is going to be the zinc, which is a major factor. The other micronutrient, that is vitamins. Among the vitamins, I'm going to project the role of C and D for this infection. So vitamin C, ascorbic acid, plays a vital role. It has large number of biological properties, but the most important property is an antioxidant and synthesis of collagen in connective tissues. We all need to understand we can synthesize all vitamins, but we cannot synthesize ascorbic acid in the body. So it becomes an essential vitamin where it has to be supplemented only through the diet. Vitamin C can support immune function. Here we are going to deal only with the micronutrients that play an active role in the immunity. So it supports the immune function and protects against infection caused by coronavirus. Also, they have proved that it acts as a weak antihistamic agent to provide the relief from flu-like symptoms such as sneezing, running, or stuffy nose and swollen sinuses. Vitamin C deficiency is associated with increased susceptibility to infection, a less robust immune response, poor wound healing in case of people suffering from diabetic foot ulcer, and an increased risk for pneumonia. Also, as we saw in zinc, here also the risk group will be people who have the comorbidities like cancer, diabetes, inflammatory conditions, people who take the immunosuppressants, or people who have the habit of smoking are likely to be the risk group of deficiency in vitamin C. Role of vitamin C or ascorbic acid is it positively affects the development and maturation of T lymphocytes. So as I said, lymphocytes play a vital role in defense mechanism. So if there is a way to introduce large number of T lymphocytes, there will be an increase in the defense mechanism. So it attributes to the maturation of T lymphocytes, in particular natural killer cells involved in the immune response to viral agents. Inhibition of ROS production and remodulation of cytokine network typical of systemic inflammatory syndrome. So we saw that in case of SARS, there is a systemic inflammatory syndrome. Also, it blocks the expression of extracellular addition molecule 1 and activation of NF-kappa B that are involved in inflammatory response, neoplastic and apoptotic process by the inhibition of tumor necrosis factor alpha. When sepsis happens, the cytokines which are going to be produced in large amounts, the cytokines surge caused by sepsis is activated and the neutrophils in the lungs accumulate and destroying the alveolar capillaries. help to eliminate the alveolar fluid. Ascorbic acid can help to eliminate this alveolar fluid by preventing the activation and accumulation of neutrophils and reducing the alveolar epithelial water channel damage. So these are the important vital properties. Vitamin C can be used as a supplement for this viral infection. So I said there are numerous clinical trials going on globally, and 3 human control trials has already reported there is significantly lower incidence of pneumonia in vitamin C supplementary group, suggesting that vitamin C can prevent or might prevent the susceptibility to lower respiratory tract infection under certain conditions. The COVID-19 has been reported to cause both upper and the lower respiratory tract infection. So vitamin C could be one of the effective choices for the treatment. Vitamin C supplementation is thus the sensible option to prevent and support the immune response in the micronutrient deficit individual at a risk for COVID-19. So you can give as a prophylaxis or as a treatment. Given the fact that high dose of vitamin C is safe, healthcare professionals should take a close look at this opportunity. Obviously, ultimately, well-designed clinical trials or clinical studies are absolutely essential to develop the standard protocols for its use in peptides. So this is the recommended dietary allowance for vitamin C based on the age, male, female, and what happens in female during pregnancy and how much should be increased during pregnancy and lactation. And you can see people who smoke, especially not other people, the smokers, because the nicotine content has a role on that. The smokers should take an extra of 35 milligram per day than the non-smokers to compensate that extra needed by the body. So normally these are the sources we all know, but since it's a water-soluble vitamin, we should be very careful. Level of vitamin C in foods depend on the growing conditions, season, because it is also going to be a phytochemical. We know this amla contains large amount, but the amount that is present in amla depends on the soil in which it is growing, season, maturity, etc. And also the cooking practices and the storage time is also very important. Since it is a water-soluble vitamin, it is easily destroyed by heat, and on exposure to oxygen, it undergoes oxidation. So absorption depends on the amount consumed. 70 to 90% is absorbed. If intakes exceed more than 1000 milligram per day, then the level drops to only 50%. So absorption drops to 50%. The next important essential micronutrient that comes under the vitamin category is vitamin D. The sunshine vitamin we all know very well. It requires only exposure of the skin to the sunlight. So as we expose the skin to the sunlight, the ultraviolet light falls on the skin and triggers the process. So ultimately it is converted through various processes as vitamin D, cholecalciferol. Vitamin D has so many important properties. The classical one is very important is it increases the uptake of calcium in the intestine. It helps in the parathyroid hormone synthesis and other mechanisms. But here we are going to see the non-classical part. In non-classical part, if you look at this picture, you can see it is antibacterial. It has anti-inflammatory response. So this anti-inflammatory response is very useful in case of this infection. Vitamin D or a sunshine vitamin has many mechanisms by which it reduces the risk of microbial infection and death. Role of vitamin D in reducing the risk of common cold. Common cold grouped into 3 categories. That is how it reduces the risk of flu. We can discuss under 3 categories. What is that? One is physical barrier. That means it acts as a physical barrier for preventing the entry of the pathogen. increases the cellular natural immunity and adaptive immunity. COVID-19 infection is associated with increased production of cytokines, CRP, increased risk of pneumonia, sepsis. I told you procalcitonin is the marker for that, and ARS or SARS and heart failure. Serum 25-hydroxy cholecalciferol concentration tend to decrease with age. In case of female, it is decreasing with the age, and post-menopause it happens. So, which may be important in COVID-19 because case fatality, it increases. What are the reasons? Reasons include less time spent in the sun and decreased production of vitamin D as a result of lower levels of 7-dehydrocholesterol in the skin. Also, people who take certain drugs, the drugs can reduce the vitamin D concentration by activating a receptor called pregnein X receptor. Drugs like antileptics, anti-neoplastics, antibiotics, anti-inflammatory agents, antihypertensive, antiretrovirals, endocrine drugs, and some herbal medicines can cause a decrease in the concentration of this receptor. And we all know increase in age tends to use all these drugs in different ways. Vitamin D deficiency is associated with increased risk of acute viral respiratory infection and community acquired pneumonia, with several molecular mechanisms to explain this association. What are the main things here is, whenever it is supplemented, this vitamin D enhances the expression of genes related to antioxidants. Antioxidation mechanism by increasing the enzyme glutathione reductase and glutamate cysteine ligase modifier subunit. Once there is an increase in the glutathione reductase, this is going to increase the glutathione. This glutathione will spare the use of ascorbic acid as an antioxidant. And this is proposed and used to prevent and treat the COVID-19. So vitamin D also plays a vital role in viral infection. It can reduce the risk of respiratory infection. So as a prophylaxis, that is without overdosing, you have to see the concentration of vitamin D circulating in the blood. Lab test for vitamin D has to be taken. See the amount that is circulating in the blood, based on which we have to place the dosage, so that overdosing will not happen. This will include people who are underlying with gastroenterological conditions where vitamin D is more prevalent. This may even more important with the absence of sunlight, people who have indoor habits. So a former director center for CDC. CDC is nothing but Center for Disease Control and Prevention, which is an important agency where we come across for all types of information pertaining to the infection. Now here Dr. Tom Frieden has proposed the using vitamin D to combat the COVID-19 pandemic. So the main source is going to be sunlight and exposure to sunlight. Apart from this, there are certain foodstuffs which contains the vitamin D, which you can take it. Consumption will increase that. So having understood the importance of zinc, vitamin C and vitamin D, what can you do to boost your immune system? Awareness of boosting your immunity is enticing, but the ability to do so has proved reluctant for several reasons. Multiple factors weaken immunity, particularly poor diet, malnutrition, lack of sleep, excess alcohol consumption, smoking, and similar bad habits. Immune system is not a single entity. As I told earlier, it requires a well-balanced harmony. It is a collection of cells, process, and chemicals that constantly defends our body against invading pathogens, including viruses, toxins, and bacteria. So, providing a diet rich in nutrients like vitamins and minerals can support the optimal function of the immune system. Especially, we need to provide the antioxidants to slow damage of cells caused by free radicals or assisting in T cell production. So, what are the measures you can undertake to improve your immunity? Reducing the stress. Stress has negative impact on production of lymphocytes. Exercise, regular exercise promotes cardiovascular health, lowers blood pressure, helps to control body weight, and offers protection against diseases. Eat a well-balanced diet with large amount of fruits and vegetables, which can combat with this infection. Get enough sleep. Studies have shown that people who get an optimal sleep are less likely to be at risk for viral infection. The sleep-wake rhythm should be maintained. Supplements like vitamin Z and D, zinc may improve the function of white blood cells that fight infection. Proper nutrition and hydration is very important. So always stay hydrated, 8 to 10 glasses of water per day to stay hydrated. Hydration will enable us to flush out the toxins from the body and lower the chances of flu. So this is the prescription that was given by the doctor who is treating the COVID person in. So you can see for the prophylaxis, zinc is 100 milligram per day, vitamin C 500 milligram per day. For a treatment, it is zinc 225 milligram per day, vitamin C it can go for 1 milligram per day. And for prophylaxis, and this is for 10 days. So these are some of the links that I have projected here to show you that clinical trials that is going on for COVID with vitamin C combination, vitamin D and zinc. And this link will enable you to understand all the trials that is going on globally. So you can visit the NIH site and you can go through all these things. Lastly, this is my hospital where we do the minimizing healthcare provider risk in OT, where during this COVID-19 pandemics to prevent the or to reduce the risk for the healthcare providers. So here I have projected a table. Basically, our hospital is a diabetic hospital where we see different types of diabetic patients from grade 1, different grades, and also you have healing and non-healing.
Hello.
Can you hear me?
Yes, madam. Yes, madam.
Okay. So this chart will be given to all patients to know the status of their foot ulcer. So this is our HbO2 facility. This is called hyperbaric oxygen therapy, which is very useful adjuvant therapy for the diabetic foot ulcer to induce the angiogenesis. So this is used as an adjuvant therapy for diabetic foot ulcers and for non-healing ulcers, for burns, and also for other disorders like autism, Alzheimer's, cerebral palsy, traumatic brain injury, sports injury, and cosmetic injury. Is available in the hospital. So the table which I have projected you is the table where in case of COVID pandemic, when the patients are not able to come and meet the doctor, they can use the table to understand the infection. So it will educate the patient to self-interrupt looking at the feet. The color code is given to understand the severity of the diseases. So white color, different colors. So the color code will be given to all the healthcare workers and patients to know about the conditions. So this patient-centric and it's very useful during this pandemic situation. Thank you for your attention. Let us boost our immune system.
Thank you, madam. Now it's open for question answer session. If anybody have any doubt or any comment or feedback, you can unmute yourself or raise your hand by using the option which is given in the Zoom app, and you can ask the question. Anybody have any doubts?
Shabir,
Yes, sir. Dr. Pradeep sir here from.
ma'am, what are the dietary sources which are recommended to increase the zinc content in the body? Zinc sources. Madam forgot to mention about the source of zinc. What sort of diet? What's either it is a dry fruits. What's the exact source of the zinc?
Sheela madam.
Hello.
Hello, Dr. Sheela madam. Have you heard the question from Dr. Pradeep, Dr. Pradeep Kumar sir
No.
from Trivandrum Medical College?
No, I didn't hear. Please tell me.
Okay,
Sir,
madam.
please repeat, sir.
Okay, it's very nice presentation, madam. You mentioned all the immune boosting agents like three, mainly zinc, vitamin C and D you have mentioned, but you forgot to mention about our source of zinc. Usually it is mentioned we need only 10 milligrams of zinc, and you mentioned to increase the 50 milligram is more beneficial to prevention of the COVID. And what are the sources and what are the consequences when you increasing the zinc content from more than 20 actually it is hyper dose, and you recommended that it says more than 50 milligram is advisable to prevention of the COVID. Can you explain the sources of zinc as well as what is the impact of increasing the zinc content in the body?
Thank you. Thank you. First of all, thank you, doctor, for your regarding this thing. I didn't mention the foods that is rich in zinc. Now, the first question you have asked me that increasing to 50 milligram. That is your question, I remember. Now, since it is a viral infection and it is going to be a severe acute infection where the virus is going to take up the host, zinc, since it has a role on inhibitor of RNA-dependent RNA polymerase, an enzyme that is used for the mechanism of production, you can stop that by using this zinc concentration. So based on the severity of the disease, we give them the supplements. Now, if you see the this slide there, I have mentioned trials. Almost all the trials I have just chosen here, almost all the trials for hydroxychloroquine, and also they have combined legumes like lentils and beans, seeds, nuts, dairy, eggs, and whole grains, all can be given. Now, if you see the major fruits that is going to be major sources there, you can use yogurt, pumpkin seeds can be used, and vegetables like mushroom, spinach, broccoli can also be used. And Dr. Pradeep, here the person is the doctor who is treating the patient in the COVID. They are giving the severity of the disease. They are giving as an adjuvant therapy to combat this as a supplement.
Okay.
Doctor, is it right?
Pradeep sir, the answer is it satisfactory? Hello. Pradeep sir.
It's satisfactory. It's definitely satisfactory. Thank you, madam.
Okay, thank you. Anybody has any doubt, you can unmute yourself. Otherwise, you can raise your hand by using the option which is given in Zoom app.
Question? Any question?
Okay, then I feel there is no more questions from participants, and so we are moving to the end of the session. Before that, I invite Mr. Ebin, BSc MLT second year student from Lisie College of Allied Health Sciences, for delivering vote of thanks officially. Mr. Ebin, please.
Okay, sir. Can you hear me?
Yeah, you can carry on.
Okay. Good afternoon to all. I deem it a great honor and privilege to propose the vote of thanks on this memorable occasion on behalf of Lisie College of Allied Health Sciences. Let me first of all start by giving glory to the Almighty God for making today's occasion a resounding success. Next, I would like to thank Reverend Father Jery Njaliath, Assistant Professor, Assistant Director, Lisie Medical and Education Institution, for his inaugural address and words of encouragement. His able guidance has always encouraged us. Along with this, I would like to thank our director, Father Management, for providing all support for conducting the webinar. Next, I would like to thank our distinguished speaker, Dr. Sheela Sasikumar, HOD, Clinical Research and Development, Hycare Super Specialty Hospital, Chennai, who despite her busy schedule has found time to this occasion by her very much informative session on adjuvant therapy, minerals, and vitamins as immune boosters for COVID-19. Thank you, ma'am, for your wonderful session. Next, I would like to thank our dearest principal, Dr. Shabir Iqbal, for his stewardship, support, vision, and commitment towards us, and for conducting and managing program, making it a huge success. Thank you, sir. Thank you so much. I also thank Dr. Usha ma'am, Principal Nursing College, and Professor Dr. Johnson sir, Principal Pharmacy College, for their valuable contribution, guidance, and encouragement. I owe a special gratitude to our beloved teachers, non-teaching staff, and students of the Lisie Medical and Education Institution, the IT department, who made this meeting possible, and all the good hearts who work behind the screen. Last but not least, once again, behalf of Lisie College of Allied Health Sciences, I thank each and everyone who
Hello, Ebin. Hello, Ebin. Okay. So before we are winding up this session, once again, thank you to all the participants, dignitaries, our fathers, professors, and faculties. So today's session is over. Thank you. Thank you once again. Thank you. We'll meet in the next session. Bye.
Thank you.
Thank you, madam.
Thank you.